Okay, I would have needed to break for part 2 anyway, so part 2. That was my husband just saying he was on his way home. Anyhow, so they say they won't transfer people, which, like I said, I'm going to call the other hospital because I don't know. I just didn't trust them. I don't know, exactly what it was, but I just felt like at Hospital A, it was like, you're the patient, you decide what we do. I just felt like it was more like what I want is what they'll do. Hospital B, it was like, these are our rules, these are our regulations, you fit into them however you want, but you can't do certain things. And I didn't like that. I don't like the idea of me going into labor and somebody else telling me how it's going to go. I want to be able to do what I want, within a certain extent to, where my baby's going to be safe and in the best interest of me and my baby. But I just don't like some of their stuff. So, the other thing I didn't like, and I didn't really pick up on it until afterwards when we were talking about it, when the labor and delivery person was talking about different pain things that they use at the hospital, she really pushed an epidural. And like this and other, I may very well have an epidural. I don't know. But I don't want to be pushed into it. If I go into labor with the idea that I want a natural childbirth, I don't want to be in a little bit of pain and have her come in, well, you want one? You want one, And she kind of described it like this. She said, I'm sure all of you want to know what kind of pain medication we use at this hospital. She said, we can use an IV pain medication, which will ease the pain. It's definitely not going to take it away. You're still going to feel it. You're still going to know you're in labor. She goes, you can have an epidural, which is going to make things so much better. You're not going to feel anything. You're going to be able to rest, da-da-da-da. Like, she's really talking up an epidural. And she goes, and then there's natural childbirth. I mean, I just felt like they were really pushing that because I felt like they didn't want to do anything that would inconvenience them. And somebody who's in more pain is going to inconvenience the nurses more than somebody that they've just been able to give an epidural to and kind of shut them up. And I felt the same way about them not allowing the fathers to go into the room when the babies are getting weighed and everything, because I kind of felt like they don't want to deal with the fathers asking questions. Why are you doing this? What is this for? So I don't know. It is what it is. But my husband was still kind of iffy. He was like, well, I don't like the idea that if you need the NIC unit, it's not there. You have to transfer for it. He said I would definitely go with the baby if we were at the other hospital, and I agree with that, obviously. I don't know. What do you guys think, though? This is the way I talked to my husband about it. I said, I feel like we know certain things are going to happen. We know I'm going to go into labor. We know, how we're going to feel about people being in the room, visitors. We know, that we don't want you to leave the baby at all. And I kind of feel like that what we know will happen, we're sure of. It's more important that we make a hospital decision based on that and not based on what, in all likelihood, probably will not happen. I mean, obviously, the majority of babies do not need to go to the NIC unit where it would have to be transferred. Like I said, at the Hospital A, they do different things that are usually done in the NIC unit right there. If there's problems with the lungs or whatever, oxygen, I forget exactly what else. But, so, I mean, that's kind of how I'm basing my decision on what probably will happen. And if something, God forbid, does happen, like I said, it's still not that far away. So definitely let me know what you guys think. If we had problems during the pregnancy or something, obviously that would start to maybe change my mind a little bit. But if we go through, there's no problems with the pregnancy, I'm not considered high risk or anything, I just really feel more comfortable giving birth at Hospital A. The other thing that I did not like, again, about Hospital B, and this really wouldn't apply to us, but it just kind of irritates me nonetheless. They said if you have a cesarean and you're by yourself, like, for example, let's say I had a cesarean and Paul went home or whatever, they take the baby to the nursery. They do not let you keep the baby in the room, which I absolutely do not like. Again, I don't feel like it's their job to tell me what to do. They say, well, because you can't get out of bed and yada yada, that's fine, but then you should be able to call a nurse into your room. They should be able to do whatever needs to be done. I just don't like the fact that, like I said, it's their rules and you have to kind of fit into them. Where the other hospital, regardless of what the situation is, you can always have your baby in your room. The nurses come to you. What a concept. But definitely please weigh in, comment, let me know what you think about our decision. to kind of pick everything else over the NICU. Any experience that you've had with anything like that, just let me know. And that's pretty much it. I have a doctor's appointment tomorrow. Very excited. The first one with the regular, doctor who's going to deliver, I guess, if that's what I choose. I'm really hoping it goes well and that I like him, because after this, not liking this hospital, I just am ready to make decisions and have them stick and move on. So I'll talk to you guys all later. Have a nice week. Bye.